Hello, everybody, and welcome to a special edition of Good Things Utah for your health. We actually borrowed Dr. Stephen Mobley from KNRS AM 570, where you can find him every single Saturday morning from 9 to 10 a.m. for the Dr. Mobley Health Hour. And by the way, congratulations on your one-year anniversary.
Thank you very much. It's great to be here for another health segment.
Well, this is a good show for everyone to watch because he is going to show us how to live a longer, healthier life, possibly even save somebody's life later in the show. And right now you're specifically talking about cholesterol and heart disease, which is a pretty serious problem.
Heart disease is still the #1 killer of Americans. I mean, the thing that's going to take us all off this earth most likely, statistically, is a heart attack or a stroke. Other diseases like breast cancer and prostate cancer get a lot of public attention, and they should. But heart disease is still the #1 killer, so we need to understand it, and particularly understand our cholesterol levels.
Okay, let's break it down then to the basics. What is cholesterol?
Cholesterol is a fatty, waxy-like substance that we get from eating animal-based products. So red meat, butters, milks, those types of products have cholesterol in them. In our systems, it doesn't get absorbed, so it floats around and it can stick to the walls of our blood vessels. Over time, as it sticks and sticks and sticks, the diameter of the blood vessels gets smaller, and that can lead to the heart attack or stroke.
So how do we get rid of that?
You got to get rid of it by eating a healthy diet. And
besides that, because I can't give up red meat. Are you kidding?
Exactly. You want to exercise at least 30 minutes every day. You want to avoid high fatty foods. So if you're a milk drinker, try and go to skim milk. If you like meat, try and eat chicken or fish. It's got less cholesterol in it than red meat. So you want to stick to some of the more healthy lifestyle things to keep your cholesterols low.
At what age should you be really concerned about your cholesterol?
Two ways to answer that question. I think anyone who's 20 or older should at least get their cholesterol checked about every 5 years, because there are some genetic conditions where your cholesterol gets high at a young age. For most people in America, age 45 for men is when we start to enter the high risk for heart disease, stroke, heart attack. For women, you lag behind about 10 years. After menopause, typically around the age of 55, is when your risk of these diseases goes up. So you want to definitely know your cholesterol numbers in your 40s and 50s.
Let's talk about the two types of cholesterol, because there is good and bad, right?
The good, the bad, exactly. There's a total number, so you simply go to the doctor, they may just order a total cholesterol. But that breaks down in the two types we've all heard about, the good stuff and the bad stuff. The good stuff is the HDL, and just remember H may be for healthy, the healthy cholesterol. That number you want to have above 40. The LDL, think of L for lethal, that's the bad stuff. You'd like to have that one at 100 or below. If the LDL is getting into the 160s and 170s and even higher, that's very serious and maybe a time to talk to your doctor about treating that.
What are some of the things that we can control and can't control for heart disease?
That's a great question, Regan, because there are things that we can't control. So if we're our sex, so as a man, I'm at higher risk for heart disease than a woman. We're all going to age. As we get older, you're going to be at higher risk for heart disease. However, things you can control. You can control your diet. So again, as we talked about, eating a low-fat diet, high in fiber, avoiding the fatty foods. Exercise, as little as 30 minutes of exercise done every day of the week will lower your risk of heart disease dramatically. And don't smoke. Smoking is a big risk for heart disease.
Can we jump back to those levels for just a moment? Because I'm looking at the levels, and everybody deals with cholesterol differently. So how do you know when you need to get treatment? What number are we looking for? Is there a magic number?
The final chapter is yet to be written because the recommendations are always changing. We used to think that for sure when your LDL cholesterol was 160 or higher, it was time for medication. But there's more and more evidence that maybe if it's even 130, 120, you may want to talk to your doctor about the medications, because we know that an LDL cholesterol of 100 or lower is optimum. And again, you have to balance that based on your own family history and other risk factors.
Okay, you brought up treatment. Is medication the way to go?
It's not the first step. First step's always lifestyle changes. And I think even the drug companies, when they run those ads at night, have done a pretty good job to encourage weight loss, healthy diet as step one. Some of us are just genetically predispositioned to have high cholesterol. And for people that are doing proper diet, who are exercising 30 minutes a day, then you may want to consider getting onto a cholesterol-lowering medication.
How do you know, which one is best?
There's a whole lot of different classes of medications out there. The statins, of which this is just one example I brought today, the statins seem to be one of the more popular medications because they have a specific role in lowering the LDL, the lethal, the bad stuff. So statins have become very popular. They tend to have minimal side effects in most people, and they tend to be very effective to lowering that most dangerous number, the LDL cholesterol.
I've heard about Lipitor before, and I know a lot of people are on that drug.
Probably all of us have a family or friend that's on Lipitor, Zocor, Crestor. They all end in the OR. So a lot of them out there, and they're very effective. For most people, the side effects are very minor. Maybe some stomach upset, constipation, some gassiness, nothing too serious when you think of the seriousness of heart disease. There are two rare things you should be aware of. An unusual muscle inflammation called a myopathy can occur in a very small number of people that take these. And if you have any history of liver trouble, you need to talk to your doctor about maybe finding a different class of medication, because these medications can be hard on the liver if you've had a history of hepatitis or something that may have made your liver a little bit weaker than normal.
You know, we talked about how the leading cause, heart disease, but what are some of the other risks that we face besides death when we have high cholesterol?
Besides high cholesterol?
What are the high risk factors of cholesterol?
The other high risk factors, things that we can control, we said don't smoke. That is the number one. High blood pressure. High blood pressure is a very significant risk factor for heart disease. All the drugstores these days have these little blood pressure machines. Put your arm in there and check to make sure your blood pressure is not too high.
Because you may have high blood pressure and you don't know it.
Sure.
I know there are probably a lot of people out there.
Look around your family. If your parents or your grandparents had a heart attack or stroke, particularly at a young age, well then unfortunately you've got a genetic predisposition to heart disease, and you need to be talking to your doctor perhaps in your late 30s and early 40s, not waiting until your mid-40s and mid-50s.
So you
All right,
mentioned
family history,
right,
yes,
and
another
then
one.
age.
Yes. And then age. 45 for men, 55 for women. You guys catch up to us after menopause.
But you did say past 20, really it's something that you should be thinking about,
Yeah.
even if you're not 55.
Yeah, because there are a small group of people who are going to have a genetic predisposition to have high cholesterol at a young age. And cholesterol, people think that it's only a disease of obese people. But there are plenty of skinny people walking around that have high cholesterol. They unfortunately just have bad genes, so to speak, and they're going to have high cholesterol even though they would appear trim and in an ideal body weight.
Okay, well, you talked about exercise and diet being a big part of healthy living and lowering your cholesterol. Dr. Mobley is going to join me in the kitchen. We're going to talk about healthy eating coming up next.